Hey, David, what's this about the pandemic being over by winter?
John, I think it's most likely Santa Claus is going to come and bring COVID with him as a super spreader.
Ho, ho, ho. Winter may be tough, but I have a little bit more hope for the spring.
Welcome to CareTalk, your winter home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Hey, John, winter's coming, and I think that means the pandemic is over. OVER.
No way. I mean, come on, David. I know you're tired of it. I'm tired of it, but the virus isn't tired of it, and it is still raging. I think the rates are going up in over 40 states. The return to college has been and school has been relatively successful in certain areas, a disaster in others. I can't imagine with the cold days of fall running into Thanksgiving when too many people I fear are going to bend or break the rules, and then we're locked inside. It is a natural breeding ground of this pandemic and this virus. And I don't see how it's gonna get better. I think it's gonna get worse before it gets better.
Yeah, well, not with that attitude. I'm shivering already listening to you talk about it with all your negativity. That's like a bad
Well,
thing
what
by
have you
itself.
got?
So John, here's what I got for you. Okay, listen. There's a bunch of new treatments that are coming in. You've got antibodies, you got steroids. We talked before vaccine distribution, and we're going to get that going. We're going to get testing going, and boom, it's going to be done. And I've got winter goes till March, so I got a while before I have to come through.
Wait. So remesivir, that thing. Um,
Yeah.
I think the study just came out. How did remesivir do in terms of improved mortality?
Trying to suck the big one. It actually not just mortality. That before what had been established was that the hospital stays would be shortened, and they said, well, assuming it has a mortality benefit, it's worth X, Y, Z, and then it comes out and it says, well, it doesn't reduce hospital stays and it doesn't reduce mortality. So, all right, we'll move that one aside. But John, meanwhile, the president and Chris Christie, both guys that are in serious risk groups, they got the COVID and they got the antibody cocktail, delicious cocktail, and they seem to be much better. So I think that get that cocktail out to everybody, and it'll be good.
Well, I think the monoclonal antibody cocktail, the new biologic treatment, may actually have a pretty substantial impact, and it's certainly the monoclonal antibodies, which are biologics that adjust the way your body responds to certain situations, diseases, viruses. There's a lot of promise there, but we don't have an ability to produce it at scale. We don't have an ability to distribute it at scale, and we're talking about millions of people, David, potentially being infected and thousands being hospitalized, hundreds of thousands being hospitalized. How's this going to work?
Well, John, I think first of all, you might want to talk about adjusting your antidepressant dose because you're pretty down right now. But I would say, listen, in the Wall Street Journal, the Daily Diary of the American Dream, there is an op-ed this week from Scott Gottlieb and Mark McClellan, and they talk about getting that antibody cocktail. And you know what they suggest, John? You'll be shocked. Distribute it in the home, okay? Not in the hospital, okay? Infusion in the home. So the home is going to save us, John, and I fully expect you to be part of it. Come on.
Well, first of all, the fact that you brought up dreams, that's basically what you're building a lot of your ideas on. But I do think that more care in the home, that's obviously what we do at CareCentrix, is going to be central to controlling or protecting people who are immunocompromised and protecting people who need to get treated. And if there's any way to move stuff out of the hospital, we should do it, because everyone knows that hospitals are very dangerous places for people who either could get sick from those who could infect them, who have COVID but aren't necessarily symptomatic, or are and don't know that it's COVID. They might think it's the flu, or those people who are just scared to go in and get infected by something else. But we're going to have to think about the logistics train. We're going to have to think about reimbursement. A lot of the reimbursements that are in the healthcare systems are biased towards paying the most for in the most expensive place to get care, which is the hospital. So all of that has to be thought through. But I do think that's constructive. But can you start coming up with ideas that aren't just based on dreams, but that are
Sure,
based?
John. I got more good news for you. You want to hear more good news?
Yes.
The flu. Okay, people are talking about the pandemic, the twin-demic. Now I'm talking about the non-demic. You know where there was no flu this year? Southern Hemisphere. Why? Because all the things that people do to prevent COVID, like washing their hands, staying away from people wearing masks and all that, guess what? That stops the flu in its tracks. So we're not going to have the flu. Also, people are going to get the flu vaccine this year, and we're going to be good. And if they speed up testing, then you'll be able to see when you think you might have the flu. Is it the flu? Is it COVID? And find out real quick. And boom, we're going to knock this thing on its butt.
Well, first of all, you just happen to be right on the flu.
Ha. Okay. Say it again.
Based on just basic following guidelines of washing hands, face masks, the social distancing. Honestly, the fact that people, a lot of 1 out of 5 businesses probably closed. Restaurants are a lot of places where a lot of people would meet. They're not going to be meeting. Restaurants, public places, transportation, all of them at much lower levels. So I think that the flu will be depressed, but that's just a distraction. We're talking about the COVID pandemic, David. I know it's a modest piece of good news. I think you'll see, probably won't be as many colds. But when you get back to the virus and the pandemic, there's just so much more we could do. You're right about testing. As you know, we've been pushing very hard for lower cost tests, faster tests, more accurate tests. The countries that have been successful at containing this virus without your distraction about the flu have been those that do rapid testing, contact tracing, quarantine, and follow basic social guidelines. If you look at countries like ours, Australia and Canada, they have dramatically fewer deaths because they followed the basics of public health and they've got testing. I think that we are at 134 deaths per million of population, and Australia is at 1 death per million. We're 134 more times more dangerous, and we have the same data, the same infrastructure, and basically the same kind of populations. We got to get that testing infrastructures built and rolled out right now.
All right, John. But surely Thanksgiving and Christmas are going to be good. Am I right?
Oh, stop.
Oh, Scrooge is here.
I think that Thanksgiving and Christmas will be good for your family because you will see less of them.
Amen. All right.
All of us are going to have to live with changes in our behavior that are frankly uncomfortable. I mean, highest traffic day in the country is the day before Thanksgiving. It's where more people travel in those days before and after Thanksgiving. That would suggest that more people are actually are historically trying to connect. There's a reason why Dr. Fauci is not going to see his kids this Thanksgiving. It's going to be a very awkward time. I think Christmas.
And what did Donald Trump said he can't see his kids either? I thought he just couldn't speak to the media, but he can't speak to his family too.
I'll let you figure out our current president's social behavior.
All right. Well, John, here's the thing. Now, there could be some positives for the holidays. So one is that people, I think, will have a real appreciation for family. So when they do see one another, they'll appreciate it, whether it's in person or, or further away. And then, it's also Thanksgiving is a good time when people talk about, advanced directives and things like that. Like what do people, older neighbors want?
I'm depressed about a lot of things. I'm not inviting you to Thanksgiving. You're going to bring up advanced directives with my mother. I mean, come on. Let's try to, in these holidays, follow social distancing, follow distance, keep the public health recommendations of the CDC in mind. But for gosh sake, you don't need more reasons to be depressed. And I don't think I am a huge fan of advanced directives and thinking through that last period of life as a family. But but this is not a year where I would lead with that before you cut the turkey.
Well, John, the thing is, I love some of these holiday destinations with nice leaves and all that. The Berkshires I love. I love Barrington, for example, Great Barrington. And they had this declaration, Great Barrington. And I think they said, what did they say? I think they said the pandemic is over, right?
Oh, it's nuts. The Great Barrington Declaration. It's a group of people who want to wish this pandemic away by waiting for herd immunity, letting the virus run riot, maybe protecting some of the vulnerable. I don't know quite how you protect a vulnerable person who needs to be served or taken care of by someone who it was likely to get the virus. I mean, it is nonsense. I mean, if we let that happen, herd immunity is something that happens when the population gets to a level of the infected or who had the virus of 60 or 80%. It is nuts to let a virus that we don't know what the total damage is. 20% of people who get it have long-term symptoms. 60 to 70% of those who get it have heart damage. We don't even know how bad this virus is. We're going to let it just run until, I mean, the economy is not getting better until we contain the virus. And if we have the ability to contain the virus, letting it run riot will just hammer us. Look at it'll hammer us physically. It'll hit the most vulnerable people first. And for those who survive it, they may have long-term physical damage that we can't even predict. I mean, what do you think? I mean, look at Sweden, David.
Well, Sweden is good, John. You know, they didn't shut down the economy, and they let people run around, and you know, how's it working out for them?
Well, I mean, they've got if you look at Sweden versus Finland, Finland is nearby, similar population. They have a mortality rate that's 5 times as high as Finland. And because this virus has no borders, just because you've got your economy open doesn't mean everybody else does. And I think that the risk here is you get the economic damage, you get more people damaged and dead, and you don't even necessarily escape the worst parts of the economic burden of this virus.
Well, John, Sweden actually has suffered probably more economically than its neighbors, believe it or not. So it's not really true that there's just this trade-off that you make between the economy and addressing COVID. There's real flaws in this Great Barrington Declaration, the whole idea of herd immunity. You know, they talk about letting low-risk people get the virus. Well, as you say, 8 out of 10 people, when they recover, so-called, you know, they have heart damage, maybe other damage. The idea about sort of protecting the vulnerable with this focused protection, it doesn't really exist. You would protect people in nursing homes. How? You know, you're having a bunch of these so-called low-risk people come in and work there. So that hasn't really worked in practice. And it's just tons and tons of deaths. Now, I do, though, think, John, coming back to your idea of Santa Claus, you know, and Christmas, which you didn't realize that you were talking about. You know, you brought me up to Sweden and to Finland and up there. I mean, that's where the reindeer are from, John. And, you know, if we talk about distribution of these antibodies, of vaccines, a cold chain, you know, Santa is a kind of lazy dude. He's only working one night a year, and he's got a global distribution network. He's got a herd and a cold chain. And why don't we have Santa Claus bring along the vaccines and the antibodies and be done with it by Christmas Day?
I think the notion that we can build on dreams and fantasies as opposed to data will kill us. And so we have to focus on the data. I'm sorry, David, but Santa's not coming.
All right, John. Well, you'll get a bag of coal. Well, you know what? That's it for this edition of Care Talk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.